For the eye exam, I am going to start with the eyebrows. I'm going to look at the lateral third of the eyebrows, looking for loss of the lateral third, which might be mixed edema. I want to look at the eyelids, the orbit first, make sure there's no fractures or displacement. Also looking for proptosis. I don't see any bulging of the eye. I want to look at the eyelids. If you could close your eye for me, please. Thank you. Okay, I don't see any chalazion. I don't see any entropion or ectropion on the lower eyelid or any size on the lower eyelid. My hands are a little cold, but all right. And I'm going to pull her eyelid down a little bit. And I'm looking at the palpebral conjunctiva. It appears pink, so I shouldn't suspect anemia. The lacrimal apparatus, you want to see if there's any excessive discharge or dryness or irritation. The sclera, looking at the sclera and the bulbar conjunctiva. The bulbar conjunctiva should be white. If it's yellow, you would think jaundice. Red might be infection. And again, I'm going to hold this down. Can you look up and to the right and up and to the left? All right, I'm looking at the injections. Ciliary injections, which run from medial to lateral, would be a bad sign, evidence of glaucoma or maybe hypertension. But the conjunctival injections, which run from lateral to medial, are normal. Looking at the cornea and the iris, covering the lens. The lens, there shouldn't be any opacities that I see. At the bulbar conjunctiva also, I was looking for pterygium, which would be a thickening of the conjunctiva, or pinguicula, which is triangular yellow thickenings on either side of the iris. And then I would ask the patient to look at a spot, and I'm going to do an H pattern, ask them to follow the H. I'm assessing for nystagmus, any fluttering of the eyes, and I'm also assessing to see whether they can follow it. All right, I'm going to bring this in close to your eyes and back up. And I'm watching for convergence, which is cranial nerves 2 and 3, and the H pattern is testing cranial nerves 3, 4, and 6. Can you cover one eye with your hand? Okay. And tell me when you see my fingers. Oh. Okay, cover the other eye. And tell me when you see my fingers. Checking the nasal field of vision and check peripheral. Okay, I'm going to be bringing my hand this way. Let me know when you see my hands, okay? Okay. All right. Yeah. Okay. Peripheral fields of vision in 3 places. Going to check the direct and consensual light for your reflex. Can you put your hand up like that? All right. And I would have the room dark for this to better be able to see the pupil reaction. Okay. And this one, you're seeing that the pupil that you're shining the light in constricts, also the other pupil constricts as well. And then if we go into instrumentation, looking at the eyes, can you just look at a spot straight ahead, look that way, and I'm going to lift your eyelid a little bit. Looking for the red reflex, and then going into the eye, focusing as you go. Get in there, have the cup pressed to the eye. And looking at the back of the eye, you're looking at the fundus and, oh, sorry.
Okay. I'm getting blind.
Oh, sorry.
No, you're okay.
Okay. I'll do it quick. All right. Focusing into the eye, you want to look around at the fundus. Okay. I was looking at the fundus, the optic disc, The cup should have all the vessels entering and exiting it. You want to look at all the arteries and veins. Look also at the color of the fundus. Should be kind of a yellowy orange color. The disc should be a little lighter, the cup again a little lighter than that. Also the macula, which is a little dark spot off to the side where the fovea is. And look at this one. Red reflex, and then go in. Also on the fundus, we're looking for the color. If it were black, that might be a malignancy. Red might be hemorrhaging. Any white spots, the cotton fluff could be evidence of a diabetes. And gray is generally benign if you see gray on the fundus. I think I'm done. I'm just pausing for a moment to listen. What, I got a minute left?
You have 2 minutes.
Okay.